So now we're going to look at kind of the viscosity of the hydrogel itself. So if I just apply a small amount onto my finger here. So here you can see it is clear and see-through, so it is transparent, and it does stay transparent. So that is one of the main key benefits of using PuraStat, especially intra-procedurally or mid-procedure. If you've come up with a bleed mid-procedure, then you can apply PuraStat as the liquid gel. As you can see, it's not falling off. So if I rotate or drop my finger, so again, it's not runny, it's not slippy, it is staying in place where it's been applied, and it is staying transparent and see-through. So this is one main benefit of PuraStat as against maybe some potential other modalities, is that once it's applied and used on the target area, it stays clear, it stays transparent, it stays in place, and it allows us to continue with the procedure, which not only obviously helps in the immediate, because we want to get the case done, of course, and do the best by our patients, but it saves many other headaches in regards to rebooking procedure times, beds. There's lots of hidden costs associated with things like that. So as you can see, it stays in place, it's clear, it's going to help us in the procedure. Obviously, it can be used at the end of the procedure as well, in regards to potentially hoping we stop any delayed bleeds. So we've showed you now how easy it is to set up the PuraStat and the catheter, combine them obviously together and be ready for use. We've talked a little bit as in terms of what happens once we've applied PuraStat in regards to that matrix barrier that forms. So if we talk a little bit more in depth and in detail, obviously, as we've discussed, it is a clear, transparent hydrogel. It stays transparent even during the procedure. So once applied, it stays transparent. Now, in the IFU, it does state that once applied and applied correctly, we should leave it and let it work its magic for 2 minutes. So once it is applied, just take a step back, let it work its magic for 2 minutes, and then once that time's elapsed, we can continue with the procedure itself. In that time, as we've discussed previously, the matrix is going to be locking in together over that oozing bleed, and remember it's licensed for oozing bleeds. It'll be locking in place for you to stop that bleed, and then we can continue with the procedure itself. Now, it's not going to clog the catheter, or it's not an extremely sticky substance that will make it very hard in regards to applying. What you will find is if we take a typical 3 ml syringe, you'll find if applied correctly, it should cover an area in regards to typically a palm of your hand. Now, in regards to application, there's, say, 2 main techniques. Now, it is very specific in its application, so we can be very precise and we can, say, dab it on, pipette it on as such. I know different units have different names for this, whether it's a blob, it's a dash, but we're just applying like so, or we can do, say, like a paint kind of stroke as such. So if you're targeting a slightly larger area or resection area as such, as I'm doing on my hand, you can paint this over, become artists for a couple of minutes whilst we're doing so. But this would be what you would do for a larger lesion area. So as mentioned, you can pipette it on, very specific, very targeted, or we can pipette it and paint it over in larger strokes like so. And that's how you would apply PuraStat through the endoscopic catheter. So now we're going to turn our attention to what PuraStat is sometimes used for or is used for. So it can be used for indications such as esophageal ESD, you have EMRs, post-polypectomy, ERCP, we've seen it used in things like Barrett's and radiation proctitis as well. So it can be used in a multitude of areas, again within the GI tracts, that's what it's licensed for. So it is quite a diverse and multi-use tool for not only achieving hemostasis as its first and primary use, but also in these other areas and indications it can be used for as well.